Hi and welcome again to DentLinks. I'm Peter Tawil, and it's my pleasure to present to you a case where we approached in a multidisciplinary way the prosthetic rehabilitation of the anterior maxilla. Dr. Sharif Masoud took care of the orthodontic treatment with the crystalline aligners. Myself did the aesthetic crown lengthening, and Dr. Ziad Saleme completed the prosthodontic rehabilitation using Emax CAD veneers. So let's jump into the case directly. The patient is a 48-year-old female. She's a famous news anchor on television, so with high aesthetic expectations. Upon clinical analysis, you can see that the patient does not suffer from any periodontal disease. Her chief complaint is the display of her anterior teeth, her teeth crowding, and her gingival smile. She's a class 1 occlusion and has obvious signs of tooth wear or abrasion. This is the occlusal shot of the mandibular teeth with composites restoration in the back, in the posterior area, and the crowding in the anterior area, as well as the maxillary teeth with the crowding in the anterior area and the composite restoration in the posterior. So the clinical findings are dental plaque, crowded anterior teeth, short clinical crowns in the maxilla, especially the anterior maxilla. We have a high smile line, a short upper lip, an excessive gingival display. This is our main concern. Fractured teeth and composite restorations. Our treatment plan would first start with the scaling root planning and orthodontic treatment for alignment of the teeth, then complete the maxillary aesthetic crown lengthening to gain more clinical crown height, and finalize the case with the prosthetic rehabilitation of the anterior maxilla using Emax veneers. We then proceeded, before any kind of prosthetic rehabilitation, of assessing the crowding she has, notably displayable here in the speech analysis. Prior to any orthodontic movement, we do a simulation with the crystalline simulation program. This is the lower anterior teeth simulation of the alignment. Clearly see here. Same in the upper jaw, the maxilla, the simulation of the movement of the teeth. We have a minor crowding, and this could be very easily solutionized with the aligner system. This is the smile display after orthodontic treatment and right before aesthetic crown lengthening. We did first the trying of the surgical guide that is based on the prosthetic wax-up. Then a gingival contouring is done. Then a proper bone sounding is done to determine the appropriate biologic width. This is the bone profile right before osteotomy and histoplasty. This is it after it. It's very important to recreate the positive architecture and to reduce the proper amount of bone, all according to the surgical guide. This is the photograph of the suturing. And this is the result 3 months post-op. It's important to wait the proper amount of time. It is 3 months according to the literature. We do a small laser touch-up to define properly the gingival contours. With this very satisfying periodontal result, I would leave the floor to Dr. Ziad Saleme to guide you through the prosthetic rehabilitation of that patient. Thank you.
So the clinical situation here is always we use Optragate because we have a very good opening, and this is a good display. A wax up, of course, was done at the lab. Then a silicone key was taken, and this is in preparation for doing the mock-up. We use this type of BIS-GMA, which is a Luxa crown, which is a composite type of material that we use for the mock-up. So this is a situation after removal of the silicone index. Now the preparation will be guided by the mock-up, and you can see how we use this burr, that is a guided burr, by having three strips of 0.8 millimeter of depth. Then using a pencil, we delineate the edges, and then we chain the burr and we start doing the prep according again to the mock-up. So this is a very conservative way of knowing exactly the amount of of teeth of enamel and sometimes some dentine to be removed, in which we conserve as much as we can from enamel, because as you know, this is a key of success in doing laminate veneers. So finalizing the prep, doing a well-designed chamfer, of course, with some good marginal level. Regarding the interproximal area, as you know, you have to go inside it, especially in this case with, you know, on 1-1 and 2-1, there was some, let's say, non-well alignments, especially on the distal of 2-1, and there was some old composite there. So finalizing the prep, of course, moving to a thinner burr just to finalize the level of the margin. The positive, let's say, or the big advantage in going into a guided preparation using your mock-up is, again, to be a very conservative, while a little bit having some picturizing on the final result according to the wax up that was done. So the polishing of the margin, in this situation we use some low speed, high torque, and we use a lot of time. The polishing burrs, the red grip, and we like to use these polishing discs for a little bit polishing. And a very nice trick to use is in shade selection, to use the app that was developed by Ivoclar Vivadent on choosing the shade. In fact, it is very important to use the dye shade that was developed by Ivoclar Vivadent to communicate with the lab the shade of the dye, and this is very important for the final shade result. In this situation, we did it in two ways. We did it the conventional ways using a custom tray with some silicone, and also we use the digital impression. We decided to do it both just for records and of course after agreement of the patient. So regarding the temporaries, again, our wax up, our silicone index, it's always our reference. We used it to finalize. This is the temporaries that were placed, and some adjustment, of course, in situ, clinically, intraorally, and patient was very happy, and you can see the result, how we started and how we ended with the temporary. This is provisional after final placement. It's always important to see the reaction of the patient to the temporaries that will guide us to the final restorations. These are the veneers after having them from the labs. Again, you see it here on the conventional impression. These are conventional dies, conventional stone models. So regarding the cementation of the veneers, we know the steps, you know, preparation of the inner surface, the fitting surface of the veneer by HF acid for 20 seconds, then some silane for 1 minute, then of course application of the bonding. We use here a universal bond, and cementation of course light curing for 20 seconds. Then we start moving of cementing the laminate veneers using Variolink light cure, which is a resin cement. Of course, it's a light cure. You have to be very careful when placing your veneer, removing the excess. Be sure that it's well seated. Then a you know, a 5 seconds pop up, removing the excess, then a 40-second to finalize. You can see here the final result, checking of the speech. The patient is very happy. This is the most important thing with this result. It's always very attractive to see these results after 1 week or 2 weeks after placement. You see the integration and the relation with the gum. I think the result is natural, and the most important thing, patient is very happy. And thank you.